Drum roll, please. The moment of truth has come. This is an analysis of what I have done. For those that are unaware, the name of my cancer, medically, is squamous cell carcinoma of tongue. And the day I found out, once I was given the word, was extremely frightening. But I'm glad that I'm able to speak on this because it is rather important. And who else would be perfect enough, right? First off, you can see right here, this was the start of my cancer diagnosis, particularly a lesion that massive, which didn't hurt, by the way, and it started all of a sudden back in November. And like I have stated before, I think the only reason that I can really think of is burning my tongue often, which I know doesn't really make sense, but this was just the beginning of what was to come. This never really changed. It was about the same size throughout the whole process until it was, removed with the surgery, and then of course radiation because I didn't need chemotherapy. But yeah, it's insane. By the way, I am warning you, this is a bit graphic, so your discretion is advised. As some of you may recall, so my left forearm was used for the reconstructing of the right side of my tongue, because that's where my cancer was, and so they used skin, which they opened up all the way down to from right at that end point right there, all the way upward, which this is what it looked like. Once I was able to remove the cast, which I had on, and the gauze pads and all that stuff. As you can see here, this is the cast that I had on for about a few weeks until I could move my arm properly. But going back to my left forearm, this is how it healed, eventually getting better day by day. Like that, like this, that, like that, like that, like this, then this, and that, so on, so forth. And this is what it looks like recently. Just like so. Then, of course, I had this skin graft also done from my left thigh, which replaced the skin that they removed from my left arm. And mind-boggling, right? So then again, I had 4 of my wisdom teeth removed as well. After that, I had basically a feeding tube and the trachea in my throat that they had to basically, place in my neck, in between my collarbone and my lower part of my neck. So yeah, there's so much all at once. Soon afterwards, the doctors then placed these bandages on my neck after they had just removed all the stitches that they had for the trachea, and it was bleeding one day, but that didn't really interfere whatsoever. So everything was all good. I also had many incisions, as you can see right here on the side of my neck. All those linings, stitches, I mean, it's unbelievable. But yes, they were all done to remove lymph nodes from that region. So hopefully that gives you an understanding of what you or anyone would have to go through, which God forbid, but even if you don't, regardless, I want to just raise awareness on this because it is highly insightful, and I don't want to, hold it against anybody, and save as many lives as possible. Just getting detected early, like I was, fortunately. In conclusion, please do not hesitate. If you notice or feel something off, please do not be afraid to see a doctor, because your life can be saved in any second by getting detected early, like I was. I hope that this video reaches out to as many individuals and learn something from this. Thank you.